Number 13. The shocking cure. Imagine being a doctor in the 18th century faced with a patient who's a little frantic. They're jittery, anxious, and generally having a bad time. What do? You grab a battery and give them a jolt. This wasn't a punishment, it was considered an actual medical treatment. They'd hook you up to a low-voltage electrical current and zap you, believing it would reset your nervous system. Sounds like something out of a B-movie torture chamber, right? But this was the early primitive version of what we now call electroconvulsive therapy, or ECT. ECT today is a highly refined and effective treatment for severe depression and other mental illnesses that haven't responded to medication. The process is completely different. Patients are given anesthesia and muscle relaxants, so they feel nothing. The electrical current is precisely controlled, targeting specific brain areas. It's nothing like a random jolt. It's a targeted therapeutic intervention that can be life-saving. But the core idea is still there, using electricity to influence brain chemistry. That's a huge leap from some dude in a wig holding a battery. The journey from a barbaric trial-and-error shock treatment to a modern, controlled medical procedure is wild. It's a perfect example of a medical practice that was born from something that looks a lot like torture, but evolved into a legitimate and powerful tool. Number 12. The cold plunge. You've probably seen some extreme athletes or wellness gurus on social media plunging themselves into freezing water. They call it a cold plunge or ice bath, and they swear by it for muscle recovery, mental clarity, and a bunch of other health benefits. It's a trendy modern practice. But go back a few centuries, and this was a form of punishment and a medical cure for madness. Doctors believed that extreme temperature changes could shock a person's system back to normal. They would strap a person into a chair and dunk them into freezing cold water over and over again. It was a brutal, terrifying experience. The core idea, however, wasn't entirely wrong. The cold water does have an effect on the body. We now know that controlled exposure to cold can reduce inflammation, boost circulation, and even activate certain parts of the brain that help with mood regulation. Modern cold plunges are not about shocking someone into sanity. They're about controlled, voluntary, and brief exposure to cold, followed by a warm-up. The entire practice is based on the idea of harnessing the body's natural response to stress in a therapeutic way. So the next time you see a celebrity bragging about their ice bath, just remember that its roots are a lot darker than they think. Basically, they're voluntarily engaging in a refined version of an old-school torture method, but with much better lighting and a branded towel. Number 11. The bloodletting reboot. For thousands of years, doctors believed that sickness was caused by an imbalance of the four humors: blood, phlegm, yellow bile, and black bile. Their solution? Get some of those bad humors out. The most popular method was bloodletting, which involved cutting a patient or applying leeches to drain what they believed was bad blood. It was a common practice that killed more people than it cured, as doctors would drain patients until they fainted from blood loss. It sounds completely insane now, like something a vampire would do for fun. But the ghost of bloodletting lives on. Today, we have a medical procedure called therapeutic phlebotomy. This isn't for a bad humor, but for a specific condition called hemochromatosis, where the body absorbs too much iron, leading to dangerous levels in the blood. In this case, removing a pint of blood on a regular basis is the only way to save a person from liver failure and heart disease. There are also a few other rare conditions where bloodletting is still used. The difference is we know exactly why we're doing it, and we do it in a controlled, sterile environment. The old doctors were just guessing, but their primitive idea that removing blood could be therapeutic turned out to be right in a very specific, modern context. The practice didn't die, it just got a PhD. Number 10. The stomach scrape. Imagine your stomach hurting so much you'd do anything to make it stop. Now imagine a doctor telling you they're going to put a tube down your throat and scrape the inside of your stomach. That's exactly what early versions of gastric lavage, or stomach pumping, looked like. The process was used to cleanse the body of toxins or poisons. It was a brutal, medieval-sounding procedure that was often done without anesthesia and left patients feeling violated and bruised. But the modern version of a stomach pump, called a nasogastric tube, is a life-saving medical tool. It's not used to scrape anything. Instead, it's used to suction out the contents of the stomach in cases of poisoning or drug overdose. It's also used to deliver food and medicine to patients who can't swallow. The entire procedure is done by trained professionals in a controlled environment, often with the patient sedated. It's a far cry from the old-school torture method it once was. The basic principle is the same, but the execution is 1,000 times more humane and effective. It's a great example of a horrifying idea being refined into an indispensable medical tool. The difference is the intent. One was to shock and cleanse, the other is to save a life. Number 7. The water torture. The thought of someone being strapped down and having water slowly dripped onto their forehead is the stuff of classic spy movies and medieval dungeons. The cure for madness was often a form of water torture, where doctors would strap a patient into a chair and dunk them in water, or have water dripped onto them for hours on end. The idea was to induce a state of exhaustion and fear, which they believed would cure the madness. It was a terrifying and inhumane practice that was essentially designed to break a person's will. But today, we have a different kind of water torture. It's called hydrotherapy, and it's a powerful tool in physical rehabilitation. It's used to help people with injuries or chronic pain regain strength and mobility. The principle is simple. Water supports the body, reducing the strain on joints and muscles. This allows people to exercise without the pain and impact of gravity. It's a controlled, therapeutic practice that is all about healing and recovery. The old doctors were using water to break a person. Modern doctors are using it to put them back together. It's a beautiful example of a brutal idea being transformed into a life-affirming one. Number 6. The leech diet. Remember when we talked about bloodletting? Well, another ancient practice was using leeches to suck out the bad blood. It was a common sight in the 18th and 19th centuries, with doctors applying leeches to patients to purify their blood and cure a host of ailments. The practice was often used for weight loss, as doctors believed that removing blood would reduce a person's overall mass. It sounds ridiculous, and it was. The leeches would often carry infections, and the practice was more dangerous than anything else. But in modern medicine, medicinal leeches are a powerful tool, particularly in plastic and reconstructive surgery. Leeches, specifically the Hirudo medicinalis species, are used to help with skin grafts and reattaching severed fingers or toes. The leeches secrete a powerful anticoagulant that prevents blood from clotting. This helps to restore circulation in the reattached tissue, preventing a buildup of blood and allowing the new graft to heal. The leeches are sterile and only used once. It's a far cry from the old-school practice of randomly applying leeches to a person. It's a fantastic example of a grotesque, ancient practice that was refined and turned into a precise and life-saving medical tool. Number 5. The smoking cure. You've probably heard the old saying, smoking is bad for you. But for centuries, doctors and charlatans alike believed that smoking could cure a wide range of ailments, from asthma to digestive issues. They would have patients inhale the smoke of various herbs and plants, believing it would purify the lungs and cure the disease. It was a bizarre, dangerous practice that sounds completely insane now, especially with everything we know about the dangers of smoking. But the ghost of the smoking cure lives on. Today, we have a medical device called a nebulizer. This isn't for smoking, but for inhaling medicine. It turns liquid medication into a fine mist, which a patient can then inhale. It's a common treatment for conditions like asthma, cystic fibrosis, and other respiratory diseases. The nebulizer is a direct descendant of the smoking cure, but with one crucial difference. It's delivering medicine, not a harmful substance. The idea of delivering a therapeutic substance directly to the lungs wasn't wrong. The method was just barbaric. It's a fantastic example of a dangerous practice that was refined and turned into a life-saving medical tool. Number 4. The fever machine. For a long time, doctors believed that certain diseases could be cured by inducing a fever. They would use hot baths, hot compresses, and even a device called a fever machine to raise a patient's body temperature. The idea was that the high heat would kill the disease-causing agents. It was a dangerous, imprecise practice that often caused more harm than good, as a prolonged high fever can be fatal. It sounds like something out of a horror movie, a doctor deliberately trying to cook a person. But the science wasn't completely wrong. Today, we have a modern medical procedure called hyperthermia therapy. It's used to treat certain types of cancer. The idea is to heat a part of the body or the entire body to a high temperature. The heat damages and kills cancer cells with minimal harm to the surrounding healthy tissue. It's often used in combination with other cancer treatments like radiation and chemotherapy. The procedure is done in a controlled, sterile environment, with the patient's temperature being carefully monitored. It's a far cry from the old-school fever machine. It's a great example of a horrifying idea being refined into a powerful medical tool. Number 3. The amputation fix. Amputation is one of the oldest and most brutal surgical procedures. For centuries, doctors would amputate a limb to prevent a life-threatening infection from spreading. They would use a variety of crude tools from saws to knives, and the patient would often die from shock or infection. It was a terrifying last-ditch effort, and it was often a death sentence. But today, we have a different kind of amputation. It's called microsurgery, and it's used to reattach severed limbs. It's a precise, delicate procedure that involves reconnecting tiny blood vessels, nerves, and tendons. It's the exact opposite of the old-school amputation. Instead of taking a limb away, we're putting it back. It's a beautiful example of a brutal practice being turned on its head. The old doctors were trying to save a life by taking a limb. Modern doctors are trying to save a life by giving one back. It's a fantastic example of how far medicine has come. Number 2. The hysteria treatment. For centuries, doctors believed that women suffered from a condition called hysteria, which was thought to be caused by a wandering uterus. The symptoms were vague and could include everything from anxiety to irritability. The cure was often a massage of the patient's pelvic area, performed by the doctor. It was a bizarre, uncomfortable, and frankly completely unscientific practice that was at its core a form of sexual assault. But the ghost of this practice lives on in modern medicine, though in a completely different form. Today, we have pelvic floor physical therapy. It's used to treat a wide range of conditions, from incontinence to chronic pelvic pain. The goal is to strengthen the muscles of the pelvic floor, which can help with a variety of issues. The practice is performed by trained physical therapists in a professional, sterile environment. It's a far cry from the old-school hysteria treatment. The basic idea that the pelvic area can be a source of medical problems wasn't entirely wrong, but the execution was completely off. It's a great example of a horrifying, misogynistic practice being transformed into a legitimate and powerful medical tool. Number 1. The smoking gun. Imagine a doctor in the 1700s telling you that the best way to cure a headache is to smoke a cigarette. Sounds insane, right? But for a long time, doctors believed that smoking tobacco could cure a wide range of ailments, from headaches to respiratory illnesses. They would have patients inhale the smoke of various herbs and plants, believing it would purify the body and cure the disease. It was a bizarre, dangerous practice that often caused more harm than good. But the ghost of this practice lives on in a different form. Today, we have nicotine replacement therapy, such as nicotine patches, gum, and inhalers. These are used to help people quit smoking by delivering a controlled dose of nicotine to the body without the harmful effects of tobacco smoke. The basic idea that nicotine can have a therapeutic effect wasn't entirely wrong. It just needed to be refined and separated from the harmful act of smoking. It's a perfect example of a dangerous practice being refined into a life-saving medical tool.